Hello everyone, today Nashi and I are going to make an evaluation of a health application named mySugr. This is our agenda. We will start by introducing this health application and main features, the backgrounds, as well as the evaluation, and we will propose conclusions and recommendations based on the evaluation. mySugr is the world's most popular digital diabetes platform with more than 1.3 million users. By combining an app-based patient interface for smart tracking with integrated devices and supplies, health data is transferred seamlessly across the mySugr ecosystem, allowing for customized digital population health management. The mySugr app allows for one to easily log in and maintain a record of the diabetes clinical data. The mySugr app also allows for easy tracking of blood sugars, food intake, exercise, and insulin. Analysis with graphs provides trends over days, weeks, or months. The app also provides analysis report, which can be exported to multiple formats such as PDF, CSV, and Excel. The app also provides individual advice and analysis of your data by certificated diabetes coaches. There's an increasing need for diabetes solutions. According to the WHO report in 2018, there's an urgent demand for e-healthcare on diabetes. About 422 million adults have diabetes. 1.6 million deaths are directly attributed to diabetes each year. 1 in 3 adults aged over 18 years is overweighted. Diabetes is an important cause of blindness, amputation, and kidney failure. The barriers identified in this page represent major challenges in the design of remote health interventions for diabetes. Breakthrough technologies and systems are needed to alleviate the barriers, particularly those associated with patient engagement. Monitoring devices that provide objective and reliable data streams on medication, exercise, diet, and glucose monitoring will be essential for widespread effectiveness. The expensive equipment for diabetes assessment could be another barrier, especially for patients in developing countries. By using mobile devices in the healthcare settings, practices have the potential to enhance productivity and reduce failure to response rates. One of the hardest things for medication professionals to control is how patients handle their medication once they have headed home. There's no guarantee that a patient is going to follow the guidelines laid out by a physician or tell false information when they have follow-up appointments. For patients that have chronic or critical conditions, keeping to a strict medication regimen can not only help patients' health, but also lower a hospital's costs by reducing readmissions. There are numerous ways that mobile technology is helping people stay healthy through sensors or tracking. The improved information access helps patients and hospitals better coordinate care and ensure that important information is shared with individuals that need it.
Well, now we will talk about the evaluation about the mySugr app. First, I would like to start with the advantages. mySugr has a strong functionality. Aside from the convenience of less hardware, the application also provides useful, practical, and real-time solutions to daily routine. Besides, it reminds users to record diabetes clinical information during a certain period of time to provide therapy compliance. Also, it offers rewards using challenges of points to encourage recommended actions and behaviors. Secondly, mySugr app has broader interoperability. As a mobile application, it not only links to the human, but also has the capability of linking other software and outside hardware. Take my Apple Health as an example. It could synchronize the activity data, nutrition data, heart rate, and health records from the Apple Health. In addition, mySugr company also offers a health package, including an auto-check hardware device to leverage its integration ability. Thirdly, mySugr app is easy to use for mobile users. It doesn't require users to have a high competency for technological knowledge. The usability of mySugr reflected in three aspects, like it has an intuitive, reliable, and simple interface, which is easy to understand. Also, users just need easy menu input to fulfill its functionalities. Besides, by using Bluetooth, users can synchronize data with a selected device. It could avoid repeated data input. Last but not least, we will introduce the affordability of one of the advantages. Compared to the heavy, expensive monitor devices, mySugr app is a free mobile application which provides diabetes management. If users need the expanded functionality, such as help from the highly trained CDEs, they just need paying $4.49 per month that could get them to experience unlimited help from the professionals. We have already spoken about the advantages. Now we will discuss the disadvantages. It is important that we understand there are always privacy and data security problems existed in Internet technologies. We see that mySugr app gave a statement of data security, but there is no evidence of implementing strong data protection measurements. Since privacy of health records are sensitive for diabetes patients, what we discovered is that mySugr still has a lot of to do in this area. Secondly, we think it should be concerning about change management in the health industry. Healthcare is extremely precise, and there is no chance for errors. In terms of new treatment or criteria for diabetes, it is essential to keep up with the changes. However, we notice that there is a lack of preparation for changes in the mySugr application, and it suggests that mySugr still has the potential to provide outdated diabetes treatment. To conclude, a technological evaluation based on the KDS framework has been given as shown in the table. KDS framework is an e-health evaluation tool built by Konja, Durrani, and Scott. The framework divides e-health into different stages of program implementation among different themes and areas, including health service, technological, and economic outcomes. According to our findings, advantages such as flexibility, affordability, and user-friendly lay on the health, technology, and economical outcomes, while disadvantages such as data security issue mainly exist in the ethical outcomes. Based on what just discussing, we would like to introduce these recommendations. First, we suggest that adding instructions for non-diabetes users. Although mySugr app is a diabetes-focused application, it is necessary to consider the non-diabetes users, since they could be the patient's family members, friends, who may help the patients to record on their smartphone. Therefore, a manual related to diabetes knowledge should be prepared. Secondly, it is necessary to strengthen the data protection. The user data is the most valuable and vulnerable assets for mySugr company. The following measurements are suggested for better data protection, such as data recovery plan, file permissions, and access controls. Here are our references. Thank you very much indeed.